Friends, you might have heard this term whiplash in sports injury reports in TV. Whiplash is a neck injury due to a forceful, rapid back and forth movement of the neck, like the cracking of a whip, hence the name whiplash. What's a whiplash? How dangerous it is? How to treat it? Let's examine in this video. Wait till the end, friends. I will give you some tips to avoid a whiplash in a car. Hello and welcome. This is Dr. Arun Naik from DocLog's channel, helping you to have dialogues with your doctor. I'm a neurosurgeon and a health blogger. Dialogue with the doctor is called a DocLog. In this channel, we have dialogues on brain and heart health, lifestyle diseases, cancer, spine health and preventive health to help you take control of your health and be on the positive side of your health. Friends, all these are the new diseases of the new age and are often neglected. Let's fight these diseases together. If you are new to the channel, please consider subscribing to DocLogs. All info, tips and tricks told in this video, I will leave the details in the description box below. If you want, you can check those out. That said, let's have a DocLog. Friends, typical case of a whiplash is caused by a car accident where the car has been rear-ended by another vehicle. Other potential whiplash causes are assaults, bungee jumping, roller coaster, football, and other high-impact sports activities where acceleration-deceleration forces is applied to the cervical spine. While the severity of the car crash usually correlates to the severity of a whiplash injury, friends, not always. Whiplash injuries have been noted in accidents at less than 10 kilometers per hour speed. What are the whiplash symptoms? Neck pain. The pain could be from mild to severe. It may be in one spot or whole neck. Sometimes it can radiate down the shoulder into the arm or hand. Some patients have neck stiffness or reduced range of motion. Headache may be due to a neck muscle tightening or a nerve or joint of the cervical spine becoming irritated. In severe cases, a neck instability is an issue. It's due to stretched or torn tissues such as ligaments. Majority of my patients also report some kind of shoulder or upper back pain. In severe cases, symptoms of tingling, numbness, weakness, or numbness radiating down the shoulder, arm, hands, or fingers can be seen. Dizziness, blurry vision, emotional changes, post-traumatic stress disorder or PTSD, ringing in ears or tinnitus, sleeplessness, fatigue, memory or concentration problems, swallowing difficulty are other symptoms seen in cases of whiplash. How to diagnose whiplash? Whiplash is a clinical diagnosis, means it is diagnosed by a clinician like me when the patient complains of some kind of neck pain after a trauma of acceleration-deceleration type of injury, most commonly a motor vehicle accident. However, the specifics of a whiplash diagnosis can be complex and has been the subject of controversy. While today's medical community better understands the whiplash, proving the exact reason for all the symptoms can be still difficult to explain. I always get an X-ray to see if there is a fracture. I may ask for an MRI scan to see the bones and soft tissues like muscles, ligaments, intervertebral discs, and sometimes brain. CT scan may be useful in difficult cases of whiplash to rule out bony injuries hidden. Most cases, all imaging studies will be normal, and identifying a problem on imaging is not required to make a diagnosis of a whiplash. I already told you this is a clinical diagnosis made by a clinician. Now, what is the treatment of a whiplash? In majority of my patients, a whiplash results in mild ligament sprains or muscle strains that heal within a few days' time, maximum in about 3 weeks. Sometimes whiplash symptoms can last months or longer. The long-term outlook for whiplash patients can vary very widely and usually correlates with severity of trauma and psychological level of the patient. Depending on the severity of pain, I advise a few days of rest if possible. In the first couple of days following a whiplash injury, applying ice can reduce pain and swelling in the neck. The ice or cold packs temporarily close those small blood vessels and heal a swelling. Then heat can be applied for a few days for complete recovery. Many of my patients report good relief with these ice heat packs alternatively. I always give some medications to relieve pain, swelling and stiffness. Sometimes I may prescribe some mild sleep enhancing medications. In severe neck restriction and pain, I may ask for a soft cervical collar to be worn during the day for about 3-4 days. Long-term collar wearing may be counterproductive and hence is not advised. I also advise physical therapy to improve the neck strength and flexibility, which in some cases can relieve stress on the spine and reduce pain. In some cases, I give cervical epidural steroid injection or a cervical facet joint injection in the back of the neck to relieve pain. Sometimes some trigger point injections also may be required. Well, surgery is required in very, very rare cases. I also advise to lead a healthy lifestyle, healthy eating, good sleep and a good posture. Stopping smoking goes a long way in relieving the long-term pain of a whiplash. What is the outlook for whiplash patients? The majority of whiplash patients recover within 3 months. However, it is also possible for the disease to become a chronic one. In a patient who experiences severe pain immediately following the injury, there is going to be a stronger pain ahead in the future. Some patients undergo post-traumatic stress disorder, PTSD, manifested by constant thinking about that accident, avoiding driving, and sometimes becoming very anxious and nervous. Some patients slip into a frank mental depression. Elder people tend to have severe whiplash injuries compared to younger people. Women are more susceptible to whiplash injuries than men. Friends, here are my 6 tips to avoid a whiplash in a car journey. Number 1, adjust the head restraint. This is the most important factor in avoiding a whiplash. Make sure that your head restraint is properly positioned when seated and driving in the vehicle. The top of the restraint need to be at the level of top of your head, never below. It also should be at least 3 inches from the back of your head, meaning there should be 3-inch distance between back of your head and your head restraint. Number 2, sit upright and wear your seat belt. Make sure that your seat is upright and you sit facing forward. Never keep your seat in a reclined position while driving. The head restraint will be useless if you are leaning to one side when the impact occurs. The seat belt helps you to stay in the best position during a crash as well as preventing a bad injury. Tip number 3, don't drive too close. Leave a safe distance between your car and the car ahead of you. If it stops suddenly for any reason, you won't need to slam your brakes, surprising the drivers following you. Leave plenty of room for everyone's safety. Tip number 4, pre-position yourself for a crash. If you realize that a collision is imminent, lean your head back on the head restraint, look forward and remain in a neutral position. You might have seen this in movies. The driver going back on the head restraint and keeping the body steady. This will help to avoid a whiplash. Number 5, keep fit. Believe it or not, friends, being in good shape helps to prevent whiplash in an accident. Apparently, people who are fit generally seem to heal quicker from a whiplash if it happens. Number 6, and the last one, friends, drive a big car. A bigger vehicle minimizes the momentum in cases of a collision. High-end cars these days are fitted with Whiplash protection seats which dampen the effects in case of a rear ending. With that, friends, we have come to the end of this video. Thanks for watching and hope you found this video helpful. If you liked, please give me a big thumbs up. Share this video with your near and dear ones to put them also on the positive side of their health. If you are new here, please consider subscribing to Doclogs. It will be my great honor and privilege to have you with us in this ever-growing community of Docloggers. Hit that bell icon to get instant notifications of my new videos. Friends, if you ever had a car accident, unfortunately, please tell us your experience. How painful it was, how did you treat the whiplash, and what was the outcome? Go ahead and drop your thoughts in the comment section below. Friends, I'll be back with another interesting Doclog very soon. Till then, feel awesome, live awesome, and take good care of your health.